WTIM. Good morning. You're listening to WTIM, your information station, and our morning show brought to you by People's Bank and Trust, where they put people first, and Landmark of Taylorville. I'm your host, Grayson Bauman, and joining me in this segment, I have Kim Bourne, President and CEO of Taylorville Memorial Hospital. Kim, good morning to you. How are you?
I'm great. Good morning and happy early Thanksgiving to you.
And happy early Thanksgiving to you. Excited we got to talk for a moment about our plans before we got on the air here today, but we have plenty to talk about while we are on air, and that is because you've got a prestigious 4-star rating recently from the CMS, and that's where I leave it to you to start explaining. Kim, what's going on with these ratings?
Well, thanks for allowing us to get out and share with the public our news we're very proud of, that the Centers for Medicare and Medicaid Services, the federal government basically, every year comes out with annual star ratings for all of the hospitals. And in the most recent rating from CMS, Taylorville Memorial Hospital scored a 4-star rating. Now that is on a 5-star scale. The more stars, the better. But we are in the most recent results, they release these every year. And Taylorville Memorial is actually the highest rated hospital in the stars in all of Central Illinois. You have to get really to the St. Louis region or more than probably 60, 70 miles away from our area, from Springfield, before you find another 4-star hospital. So we're very proud of that.
Hard not to be in that regard. I mean, if you're, I didn't realize quite that was the case when obviously you present this to me and it's like, okay, I kind of been tracking, but how does that make you feel? Obviously you're at the top of this whole deal, and that's a testament to your team and your people and your facilities, everything.
Yeah. And this is something, it's a complex formula that they use. CMS looks at a lot of 45 different quality measures. And we're always having to send information into the government, as well as they know a lot about what care was provided, certainly to the people that they're paying for that care, Medicare and Medicaid recipients. So they see all of the data around the people who had their care paid for by Medicare or Medicaid. But this rating system is really intended to give the public, because it's all publicly reported, a real clear picture of how we perform on things that should matter most to patients: safety, quality, compassionate care, timely care, not having long wait times to get into the emergency department. So it really is a very global look at hospitals' quality. It's not a very narrow focus on just one aspect of care.
For you, when it comes to those ratings, so in between each category gets its own rating, and then that's all combined to the overall umbrella rating.
Exactly. And not all hospitals see enough patients to submit data for all 45 quality ratings, which at times, if you don't have a large enough sample in some categories, they can't rate that, and that's very fair. So there are certain things in those quality ratings, for example, that Taylorville can't send data in. For example, we don't have an obstetrics unit. We don't deliver babies, and there's some quality measures around that. So we then have to have enough data in the other categories, and it's a very complex formula of how they readjust, but it is a very global look at whatever services a hospital provides, then what are the quality and safety measures around it.
Okay.
I would say one of the things that we are most proud of, and I think is most recognized as part of our reputation at Taylorville, are the patients' reports of cleanliness of the facility. That's one of the ratings. And at Taylorville Memorial Hospital, we scored a 5-star rating for cleanliness. We were one of only 13 hospitals in the state of Illinois to achieve a 5-star rating for cleanliness of the hospital. Patients said in this data, over, I think it was 98% of patients said that their hospital room and bathroom were always clean. And we're very proud of that. That is one of the first impressions that many people notice the minute they walk through our door, is the facility is impeccably clean. And we take great pride in that. We think that shows our pride in the environment, our dedication to infection prevention. and just overall quality.
Well, I've got to say, some of the cleanliness probably factors into some of those other things too. But you mentioned that's the first thing you see when you come through the
Right.
door. And so that marker seems to be one of the most pertinent or most important markers of the whole thing.
Well, we think it also shows then it's certainly very important for infection prevention. If you've got a facility that's clean, you're less likely to have um, people brushing up against things and picking up germs that then could get transmitted to staff or patients. We do have very low rates of infections in the hospital. We think it all kind of goes hand in hand, but I think it gives people a lot of confidence in whatever business you're in. If you walk in and the place is well maintained and it's clean, you know then that, hey, these people care about the environment, they care about what they're doing, they take pride. I think in healthcare, it should just be a given, but unfortunately, it's not always.
Well, clearly, when only 13 hospitals statewide actually received that recognition for that, the cleanliness level, TMH having received a 5-star for cleanliness through the CMS being that federal agency, that's something that comes along every year for you then.
Yes. So CMS releases, they update these star ratings every August, and they're published out on the Hospital Compare website. So it's medicare.gov. You can just Google Hospital Compare ratings, and they're all publicly reported. You can see then in each category, you can look up any hospital and you can compare them side by side with others to see how others compared. Again, not every hospital either submitted enough data or had large enough patient populations to get a stars rating. But of those who did, we're certainly very proud of our 4-star rating.
You've got to be. In terms of Memorial Health, kind of that umbrella and where Taylorville fits into that, did we feel pretty good in comparison to even some other Memorial Health locations?
We are the highest rated of the Memorial locations.
Look at that. Now that's got to have you feeling really good, I guess.
It does. But I also have to have a sense of humility with that, in that 1 or 2 years ago, we weren't a 4-star rated either. We were a 2 or a 3-star, depending. And so because we are so small, it really only takes a couple of patients who get an infection, or it takes just, a few surveys that aren't as complimentary, and it can take us down a notch or two. And so it's good to have a sense of pride, but we've got to be cautious and on our toes to just make sure that we maintain it. And actually, our aspiration is to achieve a 5-star rating in the next couple of years. And that's going to take very intentional effort on everybody's part to just keep raising that bar.
Well, it's very good to not be resting on your laurels, of course. But obviously, for that climb to have been made from 2 to 3 stars just a few years back to now a 4-star rating, and now we're looking at the 5-star rating going, we can get to there. And that really helps. This gives you that boost in order to know that we're headed the right direction. What is it going to take in terms of, you mentioned those patient surveys, there can be just a few that will really knock you off your mark. How do we what did you see that maybe you go, okay, that's a place that we can improve just slightly? And what other spots did you see that maybe we got a 4 or 5-star rating that you go, okay, I can still even try to improve on that?
I think one of the things that we're really looking at is how well we do with communicating with our patients when they're discharged, and making sure that they get their questions answered, making sure that the physician took time to answer patients' questions. We know we can always do better in trying to explain people's very complex care, their medications. So that's something that we have as a goal going forward.
Okay. So for you guys, again, just not kind of sitting on our hands. We're happy with the 4-star rating, but we know we want to get to 5 stars. Is that something that, in terms of year by year, they're going year by year and they're taking all that data? You mentioned the patient surveys are a part of that. What other data goes into that, like the infection rates and things like that? How do they balance the two kind of pieces of it to come to that overall score?
Yeah. Like I said, there's like 5 different categories. So they look at patient outcomes. So did people recover from their illness, whether it was a heart attack, stroke, pneumonia? They look at safety of care. So infection rates, if They look at timeliness and effectiveness, readmissions, patient experience, and each category gets weighted within there, like, 20% for each category. But then if you don't have enough data, then they adjust that within the categories. So I'm glad they've got statisticians who do that. We have also data analytics folks within Memorial that are always trying to predict what our ratings will be, because like you'd said, this data sometimes is 1-2 years old by the time that the government has analyzed it and does it. So we're always looking at what's happening today and what do we need to be improving on. We know in the future maybe a CMS stars rating will validate what we're thinking about where we are, but we're always looking at what's our opportunity today and how do we improve.
And interestingly enough, right now with the 4-star rating, to hear you say that there's still room for improvement. And yes, there is a 5-star scale, but 13 hospitals statewide achieved the distinction of 5 stars for cleanliness. In a 60-70 mile radius across central Illinois, we might be
We're the only one.
And when you consider that, but there's still room to grow and improve. I like to hear that. And that's why we are talking right now with Kim Bourne, President and CEO of Taylorville Memorial Hospital, about that recent Centers for Medicare and Medicaid Services 4-star rating that they received. We'll come back with Kim and we'll talk more about it on WTIM, your information station.
Your information station. WTIM. WTIM.
You're listening to WTIM, your information station, and our morning show. It's brought to you by Landmark of Taylorville and People's Bank and Trust, where they put people first. I'm your host, Grayson Bauman. Joining us back around in this segment, Kim Bourne, President and CEO of Taylorville Memorial Hospital. We were talking about their recent 4-star rating from the Centers for Medicare and Medicaid Services. And Kim, you wanted to let us know a little bit about not only the fact that those patient surveys went into that, but how much you've got in terms of love and appreciation for those in the community. Take me away from there if you don't mind.
Well, I was just sharing with you, Grayson, how much we appreciate the support that our community does show our hospital. They put their trust in us every day, and we increasingly see that people from around the region are coming to Taylorville for care. Just yesterday, I had a request. The nurse manager on our acute care unit asked if I would go up and talk to a patient who is here from Springfield. And she asked to speak to me because she was so impressed with the hospital and the care that she had received that she wanted to actually know how she could make a financial donation to our foundation with her year-end charitable giving. And I honestly have to say, in 11 years in this position, it's the first time I've ever been asked to go see a patient because they wanted to write a check to the hospital's foundation, which it warms my heart because I know that it's all of the nurses and the therapists and the physicians and the staff that she encountered, the housekeeper. She commented about how everybody seemed to love their job. They all treated her so well. And she was now going to tell all of her friends and neighbors that she has a new hospital and, we're worth the drive. And I just told her how much we appreciate that. And that's the reputation we want of people come because they know they're going to get high quality, compassionate care from every one of our colleagues every day.
To feel you got such great care that you're thinking, I'm not even worried about a bill. I'm worried about making a donation. That is an unbelievable deal. And to know that in 11 years, that might not have crossed your path, but also right before you're coming in to talk about this, it's kind of a cool, neat little thing that happened right before. In terms of your other services, that also plays a part in this too.
Actually, 90% of the care we provide at our hospital is to people who aren't spending the night. It's outpatient services. It's people coming in for mammograms and MRIs and physical therapy and to get lab work drawn, to get an EKG for outpatient surgery, cataract surgery. That's the majority of how we are making an impact in this community. Our emergency department, we see 12 or 13,000 people a year in our emergency department, all ages, from, actually being born in the emergency department. If you didn't make it to Springfield for delivery to, people over 100. So we're here for everybody in the community for their healthcare needs. Well,
Kim, you mentioned some year-end giving or the opportunities to do so. You don't have to maybe necessarily be inpatient and, have to feel like that's the reason for it. But if you've received that quality, compassionate care that we're talking about here today, there are still opportunities available to donate through the foundation. What avenues can we talk about? Well,
of course. And if people do feel so inclined to support the local hospital through their year-end charitable giving, our foundation director would love to have a conversation with you, or you can even give online. Just look up Taylorville Memorial Hospital Foundation, and there's opportunities online to give.
Well, Kim, before I let you go here, we've got just about a minute. Tell me a little bit about, whether it's thankfulness, whether it's patient surveys, whether it's the CMS ratings, whatever you want. How would you put a button on this here today?
Well, I think earning this 4-star rating is really a reflection of the heart of our colleagues, and they put so much heart into taking care of patients every day. And you notice that when you walk through the door, whether it's the entrance attendant who greets many people by name because they treat them like family, and all the way through the process. So it really is very heartwarming to have this validation of what I know the quality is every day.
A reflection of that whole organization that you're running at the top of, with president and CEO being the title. Kim, thank you so much for taking care of an interview with us here today and for joining us.
Thank you, and happy Thanksgiving to everybody.
Happy Thanksgiving to you. Kim Bourne, president and CEO of Taylorville Memorial Hospital, here on the WTIM Morning Show.